So we're gonna start doing something a little different around here and start highlighting some case reviews of the week, of the month, etc. We wanna do this because when a lot of people have pain or conditions at home, like we kind of feel like we're on an island, right? We don't know who to start with, where to go, who to discuss topics with, exercises, etc. So we're gonna start running through just a few of the cases we had this week and see if anybody can kind of relate to any of the symptoms that people might have. First one being is a 62-year-old female who was trying to lift her grandchild up and ended up with back spasms, right? Her husband actually is an ER doc, and they were trying to figure out what could have happened, what needed to happen, and everything like that. And it was funny, she made the joke that he can handle the emergent situations of gunshot wounds and stuff like that. But when it came to tending to her back pain, you know, she was like, she thought she needed to go somewhere else. So good news is that after exam, it was just in fact back spasms from lifting up her grandchild too quickly. So the good news is that there was no disc injury, no compression type fracture or anything like that. So we were able to start care, start treating those back spasms, get him calmed down. That way she can go back to lifting her grandchild in and out of the crib, etc. Case 2 was a 50-year-old female who came in with sharp pain, the inability to sit or stand, and had it shooting down her legs, okay? Through our exam, it was determined that she did pinch a nerve in her back, and it was probably from some type of disc injury. We didn't do an MRI to confirm that, but we started conservative care. She responded well. Pain started coming up and out of her legs, which is exactly what we want to see in those situations. And it centralized down in her low back, which then we can really get in and start doing some treatment adjustments, some core activation exercises to take the pressure off her low back, and return her slowly back into exercise as long as the symptoms continue to diminish. Case 3, 48-year-old female came in with joint pain, swelling, and a rash. That starts raising some red flags, right? So the joint pain was in fact in both wrists, both elbows, both shoulders, both hips, both knees, both ankles, okay? And so that presentation happens more often than you would believe, okay? And unfortunately, when the right labs or tests are not performed, this person, for example, was just told to continue to walk, lose some weight, continue to walk, and hopefully that symptoms go away. Now, with this many different presentations, it was determined that she would be better fitted going out of our office. We did not start care, and it's time to run some blood work and labs to determine, is there like an inflammatory arthritis, okay? Psoriatic arthritis, rheumatoid arthritis, things like that. So she actually wasn't a great candidate for us here, but we were able to put her in touch with the people that she needed to be talking to start ruling in or ruling out specific conditions. She was instructed that if all those inflammatory markers come back okay, come back in. Then we know it's safe to go ahead and proceed with care. So those are kind of some of the interesting cases that find their way into the office. And we're love to be able to sit down, start with our consultation and our exam to determine, can we help? Or is it better to feed off to a different provider? Case number 4, 52-year-old male woke up with the inability to turn his head and sharp pain that was producing some headaches, okay? I think a lot of you can relate to that. So many things happen when we're in our sleep, and it's not comical, but it's one of those where you go to bed feeling fine, you wake up and all of a sudden you're in pain and you're doing the shoulder shrug, like what the heck just happened, you know? I tell people they had one hell of a dream, you know? So removing the joke out of this case, sharp pain, loss of motion, headaches, okay? We ended up finding that he had pinched up a nerve that's coming out of the base of his skull called his occipital nerve, and it was causing occipital neuralgia, okay? So there's a triangle of muscles that sits on the side of our neck on left and right side. The way he slept, it shortened that triangle down, it pinched on that nerve, and it was causing that sharp one-sided type headache that was radiating up around his head. So he's a great candidate. We do some active release on the muscle, we do some nerve flossing on occipital nerve, and it was safe to go ahead and adjust this individual as well. So you better believe we did that. And by the time he left, decreased symptoms, increased range of motion. Told me he's not out of that neck of the woods just yet. We need to do some follow-up care, but with some home stretches and exercises, we do think he'll respond well. So this is our first, spotlight of the week, case reviews, whatever we want to call this, because I do think a lot of individuals out there don't know where to start. If you've experienced some of these conditions, give us a call. We'll either be able to, 1, help through our exam, start with care, or two, at least point you in the right direction on who you should be talking to solve your remedies. So talk soon. Keep an eye out for the next case review.